tobacco is still the leading cause of premature death, 80,000 deaths a year. So when e-cigarettes came along, we were keen to consider how they might play into tobacco control. And to begin with, people were wary. But as data emerged, it became clear that e-cigarettes were being used by smokers effectively to stop smoking. The second set of evidence that appeared was about safety. It became clear that e-cigarettes were relatively low risk. They're not completely free of risk, but when compared to smoking cigarettes, it became clear that e-cigarettes were much less harmful. So we now have 2.5 million people using e-cigarettes regularly, and they are either current smokers who use both or people who've stopped smoking completely. We have good regulation of e-cigarettes, and I think that's an important context. We also have good data from surveys about use of e-cigarettes and smoking in young people, and we are reassured that e-cigarettes remain a route out of smoking for young people and not a route into smoking, which is one of the key concerns, I think, in many countries.
Are there some numbers that back that up, that it's not an on-ramp for a young person who's never used tobacco before?
Yes, we know. We know that only 4% of young people use e-cigarettes on at all a regular basis, and the great majority of those are either smokers or ex-smokers. The number of young people who use e-cigarettes regularly who have never smoked is tiny, less than 1%.
And growth rates in the use of teens?
And they are static, they're stable.
Fascinating, because in the States we see numbers that suggest 70%, 100%, forecasts for 40% from here on.
I think the confusion is when you're looking at use, we look at the number of young people who use them regularly on a weekly basis. If you look at the number of young people who've ever used an e-cigarette or have tried a cigarette, or tried an e-cigarette, then those numbers are huge. I mean, we know young people will try things, especially if their friends have tried them. But that's a very different thing from using an e-cigarette on a regular basis. So the data do need to be looked at closely before you draw conclusions. And as I say, people look at the same data and they draw very different conclusions.
When Public Health England says that e-cigs are 95% less harmful, how do you get to a number like that?
We refer to it as the best available number. Obviously, a concept like safety, you cannot come up with a single number, but it conveys the message that e-cigarettes are a lot less harmful than smoking tobacco cigarettes. Smoking cigarettes is one of the most harmful things you can do. When you inhale a cigarette, you get tar, you get carbon monoxide, and there are thousands of chemicals in cigarettes which cause cancer, which cause heart disease, which affect your nerves, affect your eyesight. So it's not difficult to be 95% less harmful than smoking cigarettes.
And that comes across in talking to citizens of the UK who are essentially convinced that this is a risk-free proposition.
Well, I'd be delighted if that's the case. Many people do. We're worried that, in fact, a lot of members of the public still think that using an e-cigarette is as harmful as smoking a cigarette. I mean, I have said that it would be tragic if smokers didn't quit and carried on smoking because they hadn't tried an e-cigarette, because they were worried about the safety of an e-cigarette. That would be a real tragedy.
A tragedy if they'd never even gave it a shot.
If they never even, a smoker who could quit if they tried using an e-cigarette, but didn't because they were worried about the risk of an e-cigarette.
How low do you think you can get smoking rates?
Well, we're aiming for 5%.
5?
Yeah, 5% in the not too distant future.
Whereas I imagine your generational high was, say, in the 1960s or so, above 50?
Oh, it was indeed. And in fact, after the Second World War, pretty much everybody, nearly all men smoked. It was the norm.
We've talked to some other researchers who are doing work in the US on inhalation science, who argue, at least in the early stages of their methodology, that it might be less of a pulmonary event, smoking an e-cigarette, but potentially more of a cardio event, finding stiffening of the arteries long term, even in the pups of pregnant rats who've never even been directly exposed. What do you make of that research?
The animal models are very weak as a way of predicting the effect on humans, and we look at those very carefully, and we commission annual evidence reviews which takes all of that evidence into account. And there's nothing in that evidence yet which really causes us to change our view.
The researchers argue, basically they would say, cut us some slack on the animal testing because of how long it took us to get human research on cigarettes, And in the process, we lost obviously a generation of people to what was in the end a harmful product. That's too conservative a point of view for you?
Well, I mean, that's a position you have to balance against the undoubted benefits of people stopping smoking. We have a certainty on our hands, which is the harms of smoking, the ongoing harms of 7 million people still smoking, against the possibility, remote with very little real evidence of long-term harm from e-cigarettes. So yes, it's important to keep it under review, but at the moment the balance is clearly in the one direction.